So I just thought I'd take a quick 5 to 10 minutes now to talk about some of the work of SEARCH. And the reason that I thought it was important to do this is because I want to start right at the very outset in saying that there is not, when I looked back and all of the team, we all came together and you know, identified those areas of our work that we wanted to showcase today. There's not a single area of work that SEARCH does autonomously or on our own. We do absolutely none of our work without at least the partnership, the collaboration and the support of at least one other service or individual or agency, but in 99% of the cases it's more than one. So this is really a showcase of all of our work together and a quick overview of the work that we've been able to achieve over the last couple of years. The SEARCH vision very quickly is that all rural Victorians will have access and quality sexual health care information and support that is tailored to their needs. Our mission is to sustainably develop sexual and reproductive health services capacity in rural Victoria by building our collaborations and partnerships between institutions, agencies, services and individuals. Our work is now focused at the systems approach level in both of the regions in which we work, and we now cover about 40% of the state of Victoria. So the networks, as we all know, are very important to this work. SEARCH purely facilitates 3 sexual health networks in central locations in Benalla, in Bendigo and in Swan Hill. The 3 networks provide opportunities for professional development, for discussion and debate, and for sharing of promising practice. They are also intended to encourage cross-service linkages and service integration to create new, mutually beneficial opportunities within rural regions. Workers in the clinical, health promotion, education, youth and other related fields come together. Most workers do not specifically work in sexual health, and most have positions where they cover a range of health issues and straddle clinical, education and health promotion roles. We know that this lack of specialisation is a key characteristic of rural Victoria. The networks therefore help to lift the profile of sexual health and provide locally based opportunities to support workers in their respective roles. Recent examples of the topics covered during the network meetings include working with young people 16 years and under, consent, confidentiality and responsibility in a clinical context, and failure to disclose, failure to protect laws, and extending skills of those working with the LGBTI young people communities. SEARCH also continues to provide face-to-face learning opportunities that are designed to enhance rural workforce capacity. These seminars and workshops are held in rural communities and are free to participants. The focus covered over the past couple of years has been adolescent sexual health updates, medical termination of pregnancy, and the changes to the cervical screening program. The topics chosen are driven by those that inform SEARCH as to what topics they want covered. The online learning modules that Marianne so kindly launched today are available on the SEARCH website, and you've got a little flyer in your bag, so they'll give you a bit of a brief outline of what they cover. The MTOP Rural Clinical Network has been very recently established for unintended pregnancy and abortion, and it was established by SEARCH in partnership with Dr Paddy Moore from the Royal Women's Hospital and the Murray PHN in response to a number of practitioners who were involved in this work wanting an opportunity to network together. They expressed interest in collaborating across rural Victoria to provide leadership, peer learning and clinical service development. The objectives of the network are to provide clinical advice and peer support to ensure quality of care and patient satisfaction in rural locations. They promote multidisciplinary collaboration between providers and consistent services and clinical pathways. They foster collective leadership and harness the knowledge and experience of rural clinicians for advocacy and for policy development purposes. And they bring people together to share and document their knowledge and innovations, including protocols and any operational procedures that are developed. The first meeting was held just a couple of weeks ago on the 19th of July, using video conferencing at Murray PHN sites and also people using their own personal computers. It was attended by 32 practitioners across the state, including GPs and ONG specialists and medical students. This year, SEARCH has also undertaken 3 pieces of research that are focused really to better understand how rural Victorian MTOP service system has changed over the recent years, and we wanted to do this following the work that we had done with our partners. The results of these studies will be presented at tomorrow's plenary session. The first project was focused on understanding how training partnerships involving SERSH, the Royal Women's Hospital, Family Planning Victoria and the Fertility Control Clinic created a change within existing Victorian rural health service systems. The second project was a clinical audit of an established service at Gateway Health in Wodonga. The audit explored the characteristics of the women who attended the service and their contraceptive coverage at the time that they experienced the unintended pregnancy. The audit also aimed to demonstrate that this type of service can be highly accessible, affordable, safe, and can be provided in primary care in rural communities. The final project focused on understanding the women's experiences themselves through those that had had an MTOP recently through a Victorian primary healthcare service. 18 women described their experience in relation to finding a rural service, interactions with service staff and other health professionals, and what was the most important aspects of the MTOP service system to them. So those results I hope you'll find interesting tomorrow at the plenary session. The informal review that we undertook in the Loddon Mallee region was to understand SERSH's impact in that region since we've been there. So we had 13 small group interviews with 51 individual different workers from 34 organisations in the Loddon Mallee region. The geographical locations that those workers came from included Charlton, Bendigo, Echuca, Kerrang, Kyneton, Mildura and Swan Hill. The key findings were that some of those agencies had considerable variability in understanding and an awareness of what SERSH does. They said that there was an establishment of formal partnerships and engagements with senior management, and this was identified as a key factor for success in engaging local organisational structures, partnerships and individual agencies. They also told us that SERSH plays an important role in bringing together stakeholders from both rural and metropolitan areas and building inter-organisational and collaborative partnerships across many sectors and providing stakeholders with networking opportunities, which we know is very valuable. SERSH is highly valued for the various training and professional development opportunities that we provide, and particularly providing them in regional locations. Aboriginal people, LGBTI populations and young people are the current focus for many of the stakeholders in this region in improving their sexual health service system provision, particularly for these vulnerable populations. This conjunction with the SERSH priority population highlights the common ground that stakeholders share and presents an important opportunity to collaborate towards mutual goals and objectives in the future for these priority groups. Increasing SERSH's online presence and using a digital technology in simple ways, such as a digital hub or a social media site, webinars, teleconferences and the like, are some of the mechanisms that the stakeholders told us they're very ready for and that we need to move with. So finally, the last one of the last projects we've done recently in Loddon Mallee was we reviewed our condom vending machine program. I'm sure many of you will be familiar with it. It was initiated in the first between 2012 and 2016. And we wanted to know how it compared to the project that had been done in Hume. And it was interesting to note that the experiences of the 4 shires that we partnered with in the Loddon Mallee region had the same outcomes that they did in Hume. So there was no community backlash about condom vending machines. There was very little damage to the machines. The project is cost neutral and that the machines are being utilised by people in the area. Those shires that actively engaged young people and community into deciding where to locate their condom vending machines have seen more use and less vandalism, although this is just anecdotal from our partners. The review has produced reports that LGAs and some information sheets for prospective shires who want to take up this practical, affordable public health response to preventing STIs. The next project, Shout, is a campaign that sort of dovetails onto that condom vending machine project, and it's allowed young people to be actively engaged in health promotion that's aimed at them. So focus groups from each of the shires and from schools and community organisations have had their say about 2 sets of posters which are promoting condom use. They also promote STI testing and what local services are available to these young people. Currently, the final sets of posters is being developed by the design students at Bendigo TAFE, and with more community consultation, it's hoped that the posters will be taken up by all of the shires and utilised, which will further empower the young people to take control of their own sexual health, and it will allow them to promote the condom vending machines in their own communities. Another project that we did in Wodonga was called Building Ethical Relationships Together, the BERT project, and what it did was bring together a community of practice from different sectors with the aim of improving the intersectorial understanding and action around issues which related to young people's sexual health and well-being. So we drew participants from the health, education and welfare sectors. The evaluation of this community of practice found that the overall increase in participants' knowledge, skills and confidence in working together, not only with working with young people, but with professionals from other sectors. We've created resources from this project and packaged them in different ways, and hopefully can distribute them across to anybody who are wanting to work across different sectors. And very finally, Search IT. Our website continues to provide a way for Search to regularly update our partners and our collaborators and other interested persons and organisations about our work and upcoming events. I'll give a big shout out to Bree Atwood, who joined us this year. I don't know where she is. She was the conference organiser here, so you can thank the fact that Bree that we're all sitting here today. She's done an enormous amount of work, and she's done an enormous amount of work on the Search website. So this year she reviewed all the content, so hopefully you'll be able to easily find resources and project summaries, details of our upcoming events and network meetings, and summaries of past events. She's also put very clearly that we've got professional training available, and in particular the Search online modules can be accessed through our website. Search continue to regularly monitor and review and update the website content, and we hope that we continue to make it relevant to our stakeholders and that it effectively promotes the work that everybody does. We also distribute a monthly e-newsletter to communicate what's going on, and we try to provide what we would think would be other resources, or at least point you to other resources throughout the sector that we think might be of interest to you. We currently distribute this to 1,000 professionals across sectors and across workplaces and across the entire state, and some across the country. Thank you very much.